And our chairman, I would like to welcome Professor Dr. Bashi and Dr. Ibrahim for this press meet. This is a rare case scenario because a lot of endoscopic surgeries are happening for abdominal surgery, thoracoscopic surgery, whereas cardiac surgery, it is a rare phenomena. And especially in the ventricle, there are 4 chambers, and all the details will be discussed about with the help of the cardiothoracic surgeon. This is a very rare scenario because only one, whole world they have done only 2 cases. That is only in the left atrium. This is the left ventricular tumor has been performed successfully, and they will explain the detail. For this, they need a infrastructure facility, endoscopic, and our hospital has got the robotic equipment also available. He has previously done the mid-osmosis procedure with robotics. So many minimal invasive procedure has been done. They can go within 2 days. These are the advantages. With all this, with a note, I would like to welcome Dr. Bashi to explain about the details about this procedure.
Thank you. Thank you all for coming over this morning. See, I am doing heart surgery for the last 45 years. So, conventional operation only where we cut the breastbone. I just take that one. Yeah. So, we cut and stitch here. You know, the big bone cut open, then put the patient on heart-lung machine, stop the heart and do it. So, the disadvantages of cutting this, you know, the recovery time is little more. Sadharama for 6 weeks, patients can go back to their 6 to 8 weeks. The minimally invasive, abdominal surgery, gallbladder, liver, kidney, urology, heart, it is very difficult. Heart stop, clear heart damage, we have to do the operation. So, in the case, he will, Dr. Ibrahim explain. In number department, I have developed a separate department for minimally invasive surgery. It is headed by my colleague, Dr. Ibrahim. He had a higher training of 2 years. This is specific in the operation. So, here, a hole heart-lung machine connect ventricle tumor edutittu heart start details are solluvaru. So, one thing I want to tell about minimally invasive surgery, especially heart robotic, not like other surgery like general surgery or urology or any other thoracic, any other abdominal procedure. The surgeon is at risk, not the patient. Because trying to save the patient, surgeon has to adopt different positions. Sometimes you will have severe back pain because you have to do the operation through a small hole, the whole thing, and keep the patient alive after surgery. So it is a very difficult procedure for the surgeon who is doing. That not many patients realize that. They all want everything very easy, but we need hours and days and months of training. Because to do a major procedure through a small hole is not easy. And other vishayam. Adillame we need, as Dr. Raju mentioned, high-tech equipments are necessary. The high-tech cameras, then endoscope, plus instruments, long instruments, special technique for the tying the sutures, all are necessary to do the operation. I was talking to a few youngsters because I don't do minimally invasive. It is done by my young colleagues only. Some surgeons who have been doing minimally invasive surgery after 3-4 years, they themselves have developed heart, backache, neck pain, all those things the public does not know. Something that's an occupational hazard for the surgeon, especially in heart surgery. So the public also should know about it. They want, suppose a mistake, they blame the surgeon only. Something has gone wrong because no surgeons make mistakes purposefully. When you do such delicate surgery, sometimes the accuracy may not be correct as we want. So this needs a lot of infrastructure from different departments to do the procedure, and expensive equipments also. So the details, now my colleague will explain everything about this particular patient, because heart tumor left 4 chambers heart, 2 upper chambers, 2 lower chambers. Upper chamber tumor is not uncommon. That's called left atrial myxoma. Ventricle, left ventricular tumor is very, very, very rare. In 45 years, I am seeing the first case among about 25,000 patients I have operated. This is the first case in Angapakadu. Okay, so Ibrahim will tell you the details. Yeah, you can present the case now.
You want to put the video, sir?
Video?
You want to show the video? Video photo present.
But there is always recurrence. எங்கேருந்து கட்டி எடுத்தாலும் திரும்ப உடம்புல வராதாங்கிறது யாராலையும் உத்தரவாதம் கொடுக்க முடியாது. அந்த கட்டியை நாங்கள் பயாப்சிக்கு அனுப்புவோம், அதனுடைய தன்மையும் படிப்போம். மேற்கொண்டு every 6 months or 3 months once பேஷண்ட் ரெகுலர் ஃபாலோஅப்பில் வச்சுப்போம். பிகாஸ் திரும்ப வருதாங்கிறதையும் நம்ம க்ளோஸாக வாட்ச் பண்ணுற மாதிரி தான் இருக்கும். பிகாஸ் தே ஹேவ் அ டெண்டன்சி டு ஃபார்ம் தட் இல்லைங்களா. ஸோ திரும்பவும் அது உருவாகிறதுக்கு வாய்ப்பு இருக்குது. At least yearly once she has to come for follow-up.
But normally, if you remove it fully at the time of surgery, because I have done close to a few hundred of these tumors from the left atrium. In my personal experience, none of them have recurred. But I have operated on patients who operated elsewhere where the tumor has recurred. So it is important that the first time completed recurrence chances, I would say maybe less than 1%. That's all.
You said operation is risky. Why did you go for keyhole surgery? Why did you go for keyhole surgery?
As I said, sir.
Only for faster recovery or other accuracy or precision something like that?
It is definitely even in an open operation, அந்த ஏரியா அப்ரோச் பண்ணுறதுக்கு ஓப்பன்லேயும் கூட ஸ்கோப்பி தேவைப்பட்டிருக்கும். ரெண்டாவது, as a young female, again the tumor is a very small thing to do faster இல்லைங்களா. ஸோ இது ஈஸியாக பண்ண முடியுங்கிறதுனால we gave that option.
In today's world, time is money for everybody. You understand? Most of it's not like 50 years ago where people does not have much. Most of the people are working people only coming for operation. Young, for example, she is young. So, instead of taking 2 months for recovery, in 2 weeks she can go for a job. She can earn her bread. That is the advantage of this minimally invasive techniques which have advanced all over the world. See, now when you do angioplasty and stenting for the heart, they go for work after 1 week. When you do an operation, it may take another 6 weeks or 8 weeks to go for work. So idea of all these so-called minimally invasive is developing. Robotic surgery is coming in a big way in the United States. Inga the varame karanam cost jaasti irukkum. Ivarku namma aalukku yarukkum idu afford panna mudiyadhu andha madri cost. So in the US and all, it is being done by robots. But one robot will cost about nearly $10 million, the latest. That's about nearly, you can calculate how much it will come. It is very, very expensive, the latest this thing. So whenever we can do and trained people are there, minimally invasive, patient also ask for that nowadays. Most of the people are educated, they know what is available in the market. If you go to the internet, okay, I got a tumor, who is doing it immediately in 5 minutes you will get. Because you also are responsible for people knowing these things. That is one of the reasons we are conducting this meeting, to make people aware these are the things available today. If you want such and such people are doing, it is okay. You can go for work with the same result, with a better cosmetic thing, and early returning to work.
Sir, you said time is money. Is it covered under SIMS insurance policy?
I don't know about it. I have no idea. I don't think so.
So you
So
can
what will be the
say
cost conventional one than this one?
As such, there is not much difference. We are not charging much extra for this. When you use robotic, definitely we'll have to charge more. This one, that is what I was telling you. The strain is more on the surgeon who is doing the procedure. Patient, it is less stressful. So as such, because the problem is our patients, most of them cannot afford much. So at the moment we are doing with almost the same. When we use high grade equipments for endoscopic things, that scope charges we'll have to levy to the patient.
What is the difference of cost? Difference, cost difference?
Maybe I would say about 25% more. That's all. Than a conventional operation. Only other problem is theatre time konja extra edukudukku. If a normal operation, if you do, say I take say 4 or 5 hours, sometimes this may take little more than that. But trained, as you get more and more operation, but doctors get trained more, time will be almost the same.
Learning curve.
Learning curve it is called.
How many doctors are trained this
In our unit,
Ah.
he is the one who is trained for that.
Sir, this operation, can you say it's first in India or first in
Yeah, this one is for tumor from the left ventricle done through this is first in India only. To our knowledge, yeah, definitely.
பேஷண்ட்டுக்கு அனஸ்தீசியா கொடுத்துட்டீங்க
Ah.
அப்புறம் ரைட் லெக்ல வெயின்ஸ் வழியா பிளட் சர்க்குலேஷன் இந்த தமிழ் ப்ரெஸ்கிரைப் இருதய நுரையீரல் இயந்திரத்தின் உதவின்னு சொல்லி
The heart lung machine.
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 இப்போ நம்ம ஒரு ஆப்ரேஷன் பண்ணும்போது ஹார்ட்டில் ஆப்ரேஷன் பண்ணும்போது ஹார்ட்டை நிறுத்திட்டு தான் பண்ண முடியும். இப்போ ஹார்ட் ஹேஸ் டு ஃபங்க்ஷன் வித் த லங்ஸ். ஹார்ட் அண்ட் லங்ஸ் ஒர்க் டுகெதர். இது லங்ஸ் வந்து கிவ் ஆக்சிஜன் இன் டு த பிளட். Heart function is collect the impure blood, pump it into the lung, and lung will give oxygen, and the oxygenated blood comes to the heart. அது நம்ம பாடியில் மூளையிலெல்லாம் போகும். இப்போ ஹார்ட் நிறுத்தும்போது lungs also will have to stop. So there is a machine which we use. One is the artificial lung, another is the artificial heart. இப்போ impure blood எடுத்து ஆக்சிஜனேட்டரில் போட்டு ஆக்சிஜனேஷன் பண்ணிவிட்டு அது பம்ப் into the patient through the aorta. அதுதான் ஹார்ட் லங் மெஷின் ஒர்க்கு. அந்த டைமில் பேஷண்ட்டை வேணால் கூல் பண்ண சில டைமில் இப்போ நாங்கள் அயோர்டிக் சர்ஜரி எல்லாம் பண்ணும்போது சர்க்குலேஷன் நிறுத்த வேண்டியது வரும். இந்த மெஷினில் பிளட்டை கூல் பண்ணதாக ஃபெசிலிட்டி கூட இருக்குது. சம்டைம்ஸ் வில் கூல் பிளட் 20 degrees 15 degrees எல்லாம் கம்ப்ளீட் ஹோல் பாடி கூல் ஆகிட்டு த பாடி ஆல் வில் பி ஸ்வெட்டிங் பிகாஸ் ஆஃப் த கோல்டு. சர்க்குலேஷன் கம்ப்ளீட்டாக நிறுத்தலாம் ஃபார் ½ an hour. நத்திங் வில் ஹேப்பன் டு த பிரெயின் டிஷ்யூஸ். எல்லாம் நிறுத்திட்டு சர்ஜரி பண்ணுவேன். அதான் அட்வான்டேஜ் ஆஃப் ஹார்ட் லங் மெஷின்.
சார் ஹார்ட் பீட்டை வந்து ஸ்டாப் பண்ணுறதுன்னு
ஆ
இந்த ஹார்ட் பீட்டை மேக்ஸிமம் எவ்வளோ நேரம் வரைக்கும் ஸ்டாப் பண்ணலாம்?
ஒரு மினிமம் 5 to 6 hours நிறுத்தலாம். அந்த டைமில் ப்ரிசர்வேட்டிவ் இன்ஜெக்ஷன் போட்டுகிட்டே இருப்பார். எவ்ரி ½ an hour we inject medicines into the heart so that heart will be protected.
This type of operation can be done for all the patients, each age, sir?
Yeah, all ages it can be done.
No,
Yeah, yeah,
all
all-
age